honorable guests, and dear participants. Today's speeches have beautifully reflected the importance of science, cooperation, and awareness in protecting global health. Now, it is time to hear from a distinguished guest whose words will further inspire us to stand with science and work collectively for global health. At this point, it is my great honor to invite Dr. Mukhtiar Hussain Bhayo to address the gathering and share valuable thoughts with us.
Honorable Madame Sadia Rashid, Ms. Fatima Munir, our teaching faculties, our colleagues, students, and those all colleagues who are online, along with the students and Dr. Sara, WHO, EMRO, all these colleagues, good afternoon and Assalamualaikum. I'm really feeling ecstatic also to be here on behalf of WHO and also as a son of soil to be part of this International Health Conference. And let me thank once again Hamdard Foundation in general and Madame Sadia in particular for leading, as always, every year we start. It's a kickoff of the global events of World Health Day, and it almost always starts from the Hamdard Foundation events. So even this morning I received a message from WR, where are you? Are you going to attend this conference? I said, yes, I have to. How can I say no to Madame Sadia once she invites us on this really prestigious event? So thank you once again. And see, I was so emotionally listening and watching the students, the participants, very youngest ones to maybe 10 years or 12 years, and these all students, the way they express this World Health Day event and the theme, it was really impressive, highly inspiring for me as also the WHO representative. And although this land is rich in producing the real, true philosophers in the past, like Allama Muhammad Iqbal and Shahid Hakim Muhammad Saeed, these kind of philosophers are really not only for that generation they were guiding, but they truly gave us a vision for the next generation. And still the next generations to come for the Pakistan and this country, those visionary ideas and the guidelines they provided us that are still leading us. And I think this, when I'm sharing you today, that while they will continue to guide us for the next generation, let me quote this. Maybe 2 days ago, I just searched the speeches of Shahid Hakim Muhammad Saeed. Few good speeches when I was watching carefully. I said, okay, this hour is for Hakim Saab. I will watch him, whatever is available on the internet. And trust me, let me quote his words. While he was uttering with the students some gathering of Non-Nihal gathering, he said that if any nation, I'm just quoting his words, if any nation has to sustain or survive, that nation need to work on two things. He showed like this, two things. And then he stopped and said, health and education. And he further continued to ask the students also, can you buy health? While going to market, I will pay you, he said, I pay you 1,000 rupees. Can you go and buy health? And he said, no. You can't buy a health by just putting few thousand or money. But to achieve that status, you need all to work together, work hard for continuity for time. So when I was listening those words, it clicked me the theme of this year 2026. In this theme, what the WHO is saying, you have to work together. And you have to, everyone has to work. When you go in the detail of the theme, subject of WHO, they are writing that for that reason you have to continue working for the, and everyone has to participate. So these words of Hakim Sahab was in 90s. While I'm saying these visionary philosophers are not for that only generation, but they, whatever they are saying, for the next generation to come. And today when WHO deciding for this theme, and I'm just sharing with you how this theme is decided. It is not decided by a one person, Director General of WHO or RD will sit and write down, this is the theme for the next year. No. There's a global committees. All regional head countries has to share. We also write some themes. And there's a lot of discussion for this year, what theme we will follow. So when they reach to that theme, all together globally, and we had a philosophers who already wrote these themes years back. So we should feel proud of all those philosophers like Shahid Hakim Muhammad Said, and we are once again very proud to see Madame Sadia continue, this legacy of his vision. Thank you, Madam. We really feel for this. So that's why I can never say no to you whenever Hamdard Foundation is asking to participate or anything I can contribute as a WHO, as a son of Sahel, we will be with you, Madam, as a member. Even I was telling my wife, maybe after retirement I will volunteer without getting any payment. I will do something for Hamdard Foundation. If I can even go and continue deliver some sessions, inshallah, I will be alive, I will participate. I will be part of your team, inshallah. So coming back to this theme, as I think listening to our these speakers, they touched very nicely. Even the science part or the together part, the keywords are these. We have to work together and we have to trust on scientific developments in the past and what science has achieved in the health sector. And I think a lot of examples were quoted, like in COVID, like so many diseases now are treatable. If you go back to 1 century ago, you can see that in anyone diagnosed with the TB, even this century start, they left that guy to die. There was smallpox, millions of children died. So many diseases were left untreated, and now they are treatable. And I'm just trying to tell you, with this COVID-19 alone, millions of people's lives were saved. And how quickly scientists came to developing a vaccine within months to save the lives of millions to come. And even you see, currently, even we had the vaccine already developed for different diseases. They are in process, like for malaria, like for cancer, even there are some vaccines are being produced. So many areas the scientists are continuing working. So this thing, and the togetherness is the key. What Hakim Sahab was also saying, everyone had to participate and we have to work together. It's not only doctors or only medical scientists who have to work. This theme is saying you have to continue work on the One Health approach. And One Health approach is saying like it is impossible to work alone, inextricable. When you think that we can only work on humans and we'll be healthy. It has never been possible. In the past, it will never be. If you see the diseases, known diseases everyone knows, like COVID, rabies, avian influenza, anthrax, hemorrhagic fever, monkeypox currently, the outbreak. These all diseases have started from animals. And what we have been doing, we are trying to do everything with the humans. Preventive vaccination, preventive programs, we are talking with the animals. But we have little ignored the actual root of the disease. The actual root from where the disease has started are mostly animals, are the overall environment, your atmosphere where the situation is getting worse. So these two sectors, this time WHO has started seriously working in Pakistan with this World Bank support. We had enough funds available for coming 2 to 3 years to work jointly, the animal sector and also the environmental sector. We are working close, especially we are, even from the WHO side, we are developing the lab facilities for animal health, lab facility for fisheries, lab facilities for all environmental support. Because now we realize that it is not possible, whatever we do for the human alone, will not be healthy. So health has to come at the cost of clean environment and the healthy animals as well. So these two areas we have to work together. Those colleagues who are working with the animal sector, fisheries, and with the birds, so they are equally important to work, with the full day and night to keep human healthy. So these are all things. We have to go little even further. We are talking either curative or preventive. But now is the time we need to work for promotive health, to sustain and maintain the health status before getting sick. So this is the status where if we work together as a One Health approach, and then we think of health promotive activities with exercise, good food, and less stress, and then all the things combinedly can promote your health status. So I will not talk much. I already listened a lot of good speeches, and I will just let me thanks once again Hamdard Foundation and all these teaching faculties who are behind this successful event. And this is just kickoff. All year we'll be continue having such events in different places. But with Hamdard Foundation always leading, once again congratulations and thank you so much for this. Thank you.
Thank you very much, sir, for your inspiring address.